Good day. My name is Timothy Malone, and this is an Ebola case study from the perspective of the health educator. As we have learned, the health educator's role in an epidemic is to keep the public informed of how the epidemic is being perceived without creating mass hysteria. So first off, what is Ebola? Ebola is a virus that causes eternal bleeding, is a hemorrhagic virus. The original source of the virus is believed to be a species of bat. This virus can also be transmitted to humans and other primates such as chimpanzees and gorillas. The virus was first discovered in the Ebola River of the Democratic Republic of Congo back in 1976. And currently, the case fatality rate for Ebola is approximately 50%. How is Ebola spread, you might ask? This virus is primarily spread through the direct contact of body fluids. Body fluids are defined as blood, saliva, tears, vomit, feces, urine, and semen, amongst others. The virus can also be spread by coming into contact with a contaminated surface. If one of the body fluids is put onto a surface, such as the examination table, operating table, doorknob, bus seat, another individual can come in contact with that, and as a result, be diagnosed with Ebola. Additionally, Ebola can be spread by coming into contact with the body of a deceased person who was infected by the virus. So family members, as well as people who work with deceased bodies, should be extremely careful when knowing that a person has been previously diagnosed and are deceased from Ebola. Additionally, and lastly, Ebola can be spread by coming into contact with the slaughtered animals who have been affected by Ebola. Many farmers might slaughter an animal that was contaminated by Ebola, and therefore they would become infected by coming in contact with that animal's fluids. This diagram depicts what I just talked about, that it originates from bats and can go to other mammals and primates, which in turn can come to us, and then the human-to-human transmission can go from funeral practices, unprotected healthcare workers, and also just unprotected contact with body fluids and blood. As well as survivors, it shows here, need to realize that they might be tired, have additional muscle aches, and face stigmas as they re-enter their communities. So what are the signs and symptoms of Ebola? First off, signs and symptoms can present anywhere from 2 to 21 days post-exposure. Most commonly, they present 8 to 10 days following an exposure. Early symptoms include fever, chills, muscle aches, and weakness. As you might be thinking, these mimic the flu virus. Symptoms that present later are not limited to, but include nausea and vomiting, respiratory distress, bleeding and bruising from the eyes, mouth, and rectum. Remember, Ebola is a hemorrhagic virus, which means it affects blood clotting throughout your body, hence the bleeding from eyes, mouth, and rectum. Also, symptoms are not specific to Ebola, so early detection and diagnosis is tricky. Now, moving on to the diagnosis of Ebola. Early diagnosis, as I said, is tricky as the symptoms mimic other viruses such as malaria and the flu. The best chances of being diagnosed early with Ebola is to be honest with your medical provider regarding your medical and travel history. This is imperative as it can differentiate between being exposed to malaria or contracting the flu and actually having Ebola. Once your provider suspects that you have been infected with Ebola, he or she will run some laboratory tests to confirm the diagnosis. These include blood tests, urine tests, oral swabs, and stool and sputum cultures. Once you're diagnosed with Ebola, treatment is usually done per symptom as they appear, as there is no specific treatment or medication to treat Ebola. Usually supplemental oxygen and fluids are used to keep patients hydrated and stable. The providers will also frequently retest your laboratory work to monitor the status of the virus in the body. These patients must be kept in isolation, even after death, to prevent future exposure. As you can see, more research is certainly needed to develop antiviral drugs and vaccinations for Ebola. So how can we prevent Ebola since there is no vaccine? First off, we should follow proper hygiene protocol. Hand washing is a must. We need to properly wash our hands, and that will limit the contact that we have of body fluids, as well as blood and other contact that we might have with infected individuals or animals. Also, we need to avoid touching the eyes, mouth, ears, or nose without first washing our hands. Even then, please try and limit the contact with those surfaces. Also, avoid contact with people, animals, and their belongings suspected or confirmed to have Ebola. Remember, this is extremely contagious, so we want to make sure to limit our interaction with those who have the illness. Also, ensure that all open wounds are properly bandaged, as we know that the disease and virus can spread through blood and other bodily fluids. So how do we prepare for an outbreak? There is no vaccine available. Early surveillance is essential, as outbreaks often occur in multiple species at the same time. We must partner with other agencies, such as the state veterinarian and medical officer, to monitor possible cases across humans and other animals, such as primates. We need to test all possible cases. It might just be the flu, it might be malaria, or it could be Ebola. And once the virus is confirmed, we need to identify everyone the infected individual has been in contact with for 21 days and test them as well, as the infection is extremely contagious. And an outbreak is declared over after 42 days or 2 incubation periods without any new cases. Thank you, and here are some references from my report.